Signs and symptoms of hepatitis. And some of these go to just general parts of inflammation, and some of this goes to direct effects of your liver being knocked out. So, general fatigue, fever, and nausea. Why? When you have an inflammatory response, your immune system releases a lot of chemicals, cytokines, to draw your immune system to the area, and all of that ramps up your immune system. And so you're going to run a fever. You are going to feel tired. You're going to feel nauseated. You're going to feel run down. You just feel terrible. And some other things are going to be related to the function of your liver. And if you remember, your liver is part of your digestive system. It also has some endocrine role, and specifically, your liver makes and stores glycogen, so it stores glucose. It filters your bloodstream from toxins, and specifically, all of this material that just got digested from your GI system goes directly to there. So that's going to be impaired. And it's also a major synthetic organ. So when we did your circulatory system, your blood vessels have to hold a lot of water inside your tubes, essentially. And so a lot of the proteins that get made, your plasma proteins, albumin, clotting factors, aside from having a function for helping your blood clot, they also just hold water inside your circulatory system. And so those, if they're not getting made by your liver, will all show their effect when your liver doesn't make them anymore. So you'll swell up. Why? If they're not getting made by your liver, your bloodstream can't hold on to fluid as well. Toxins will build up. So if you are not able to process ammonia anymore, which your liver normally takes care of, it's going to build up. So it has an effect on your brain, and you'll show up as being disoriented and confused. Bilirubin, so that picture that I showed at the beginning of the slideshow, your eyes turn yellow. It also has toxic effects in your brain, and can cause permanent brain damage, which is why we treat infants. You can't make bile. And so, aside from not being able to excrete it in your from your gallbladder, you don't make it, and it has a hard time digesting a fatty meal. And you're also going to have trouble regulating your blood sugar levels, because if you don't store glycogen and you can't make it, you have trouble releasing it if your blood sugar drops low. Your pancreas can signal your liver to say, hey, do something, but you might all of a sudden start having a hard time, because if there's no glycogen to release, what are you going to do? So how reversible is the damage? So it depends on the cause. So let's go back to where we were. Hepatitis A and E. These are acute, usually an acute hepatitis, and in the vast majority of cases, you get a full recovery. You tend to be sick for the course of, think of 1 to 2 months, so 6 weeks, plus or minus a little bit on each side. Liver failure is rare, except in the cases of people of pregnant women, or if people have got some sort of pre-existing significant condition, or in the third world if you can't seek medical care. Hepatitis C. There are 2.4 million people approximately in the United States that have this right now. 10 to 20% of these people will go on to have cirrhosis and liver failure within about 2 to 3 decades of when they're diagnosed. And you have about a 1 to 5% yearly chance of getting liver cancer. So those are horrible outcomes. If you are going to have liver failure, there's a significant consequence to that. If you have liver cancer, there's a significant consequence to that. But in the meantime, the rest of the people are kind of just living with it chronically. So kind of depends on how you look at it. And we will pick up with hepatitis B and D when I get back.